In health news now, we're talking about what's become known as the silent thief of sight, glaucoma. According to the U.S. Centers for Disease Control and Prevention, approximately 3 million people have it, and it's one of the leading causes of blindness for African Americans. Joining me now to talk more about the disease that often goes unchecked is Dr. Christopher Colbert. He's the Assistant Program Director of the Emergency Medicine Residency at the University of Illinois. Doctor, thank you so much for being with us. The National Eye Institute recommends that African Americans age 40 and older should be evaluated for glaucoma, and even earlier if there is a family history of glaucoma. Tell us about ethnicity being the driving risk, and tell us a little bit about what exactly glaucoma is.
So, glaucoma is a condition in which there's significant pressure within the eye, and that pressure puts pressure on the optic nerve, resulting in blindness. Now, there's different categories of glaucoma, but specifically to give further insight, African Americans are 5 times more affected by glaucoma than anyone else. Coupled with that, we are 6 times more likely to be blind secondary to glaucoma, and 10 years earlier for the onset of glaucoma to affect our vision than any other population. It's extremely important that we are cognizant of these concerns. Risk factors specifically is family history. 20% increase in those individuals whose parents have glaucoma and their children are as well. So, as you communicated, having regular checks, specifically when you're 30 years old, 35 years old, excuse me, if known history is extremely important.
Okay, so what symptoms should you look out for?
Perfect question. Painful vision loss. Now, this vision loss can range from seeing spots peripherally or tunnel vision or halos around lights, also associated with headaches and just blurry vision in general. And again, any of these symptoms can be the early signs of glaucoma. So it's so important to have early assessments where the pressure of the eye is assessed at ocular exams. So it's more than just having your vision checked, it's also having the pressure assessed in your eye as well.
Is that done by an optometrist, or do you specifically have to go to an ophthalmologist to get checked for that?
So both an optometrist or an ophthalmologist have the capacity to assess both your vision and the pressure in the eye, which again is so extremely important. And remember, other risk factors are individuals, specifically in the African American community, greater than 40 years of age, history of hypertension, history of diabetes. And the biggest thing is family history. And I'm surprised when I have patients come to the emergency room and you ask the question, hey, do you know if you have glaucoma in the family? And the question is no. And they pick up the phone and call their family member, and sure enough, the answer is yes. So a big aspect of this is communicating with family members, communicating with your children, communicating with your brothers, sisters, uncles, and family members. If there are specific conditions that you have, we have to communicate this so that there is earlier testing for our family members.
Okay. Now, what about treatment options?
So the treatment options vary. There is open angle glaucoma and closed angle glaucoma, and the degrees in which you are presented to the emergency room and seen by the ophthalmologist, and the management varies. For many individuals, there are drops you can place in your eye that can significantly decrease the pressure and ensure that the pressure does not elevate. But for more individuals, there are different options that's kind of a little bit beyond my scope of practice as an ER doctor. I can identify glaucoma, and then I communicate with an ophthalmologist to come in and specifically give the final management. And the management varies based on the condition and the severity of the glaucoma.
All right. Thank you so much, Doctor. Appreciate you enlightening on that very important topic. Thank you so much. And stay with us, everyone. Much more news ahead. We'll be right back after this quick break. This is BNC.